I was one of the founding fellows of the European Society of Cardiology, and it's grown. It used to be the little brother or sister of ACC and AHA, and now it's a bit bigger. The ESC has been around a long time, and of course we have many national societies, but the common platform for us is the European Society of Cardiology. It's really happened over succeeding years, but I think that there have been important initiatives in Europe in terms of the science, the infrastructure and training, and I'm glad to say we've been able to do a few innovative things which you may have seen around the Congress. For example, no longer having a conventional lecture theatre. You have a hub where people can walk up or walk away, and it seems to be a magnet for people encouraging interaction. Well, I think that the whole Congress is obviously an exciting event. There were some personal things for me which are separate from the scientific highlights. I'm a little embarrassed to say that I was awarded the gold medal of the European Society of Cardiology, so that was a highlight for me. I think the scientific highlights have been across several fields. There haven't been blockbusters of single large studies, but there have been incremental developments in several fields. And these include, for example, there's the whole issue of hypertension and resistant hypertension. And it was thought that the solution to this was ablation in the renal artery. But it turns out a lot of these patients that have so-called resistant hypertension are responsive, especially to the combination of standard drugs with spironolactone. So the vast majority are responsive. And this is going to revolutionize our treatment of hypertension, being able to achieve goal in a much bigger proportion of patients. There's a similar revolution going on in lipid management, where, presented as one of the hotlines is some of the data from Improve It, showing that there is a continuous relationship of improving outcome all the way down to very low levels of LDL. And the new developments with the PCSK9 inhibitors are exciting and innovative, and I think there's going to be an important place for them. One's got to start with the areas where there may be the greatest benefit. And prior to the development of this class of agents, there was a real challenge for those with heterozygous familial hyperlipidemia. And if you've got a treatment whereby the use of the treatment on top of maximally tolerated statins further lowers LDL by an additional 50% and allows more than 80% of these people to reach target, that's a revolution. Now the question is, who else is appropriate for those therapies and what can be afforded? But that's a larger consideration beyond this. There's a lot of discussion, debate and excitement about the whole area of what happens after acute coronary syndrome, because there's increasing awareness, and we've conducted the very large GRACE program, which has demonstrated the event rates in the late consequences of ACS, so that 5 years out, 20% of these people are dead. 3 years out, about the same proportion have death MI, and that's it despite current secondary prevention. And now we have awareness that there's not only the culprit lesions, but the other lesions as well, and the need to tackle these in a more systematic way. So there's an increasing awareness about secondary prevention, about the strategies to deal with invasive therapy to other lesions if they are significant, and then how do you achieve the optimal secondary prevention as far as the whole patient's concerned. So I think that's exciting, and there's a lot of debate and discussion about duration of dual antiplatelet therapy, which is also a focus in this Congress. I think the studies that we've just been talking about of how you can fundamentally change hypertension management, lipid management, secondary prevention, what should you do about other lesions in the coronary artery system. These are fundamental, and they will change practice. Each year we have a different focus, and what we've got to do is think about the fact that the risk factors, many of these are modifiable, and they're modifiable not only through what we eat and what we do, but maybe also what we're breathing in and what we're exposed to. The environment is something that's been raised as important internationally, and you know, our own groups in Edinburgh have done studies around the world, and although we have some levels of pollution, there are levels in some other countries around the world that are 100-fold higher. So this is an international problem, it's not just a local problem. Well, it's great. You know, we've had terrific involvement of the British Cardiac Society, of colleagues from the UK, and you know, to have the involvement of all of those, and young trainees coming, getting involved in the sessions and presenting is terrific.